Hey, good morning, everybody. It is Doc. Man, it's looking white. Hi, I am here because I wanted to talk about something very important before I go off to work and start my busy day. But I wanted to definitely talk about, as a clinical supervisor, as a therapist, as just a regular human being, talking about mental health in this field, or what we call counseling and therapy and clinical counseling and clinical therapy and psychotherapy and all those great other therapies. But mental health, that's important for us as um, staff, as leaders, those that have private practice, those that are doing mentoring and so forth. It is very key that we look at our own mental health first, because it's very hard to help someone when you yourself are struggling. And I know a lot of people that know me are going to say, all right, so you're trying to preach to the choir, but Pastor, you need to look in the mirror. I understand this definitely. There's a lot of key aspects that we have to look at. Often when we're working with individuals, whether you're supervising potential individuals that will potentially become LPCs, LCSWs, LMFTs, and so forth, whether you're working with paraprofessionals, whether it's core agency or IFE agency or so forth, you often have to, in your supervision, get people to check in with their mental health. There are some important aspects that you have to watch for when helping individuals. They have to be able to understand their own bodies. They have to understand their time management of their resources. They have to be able to separate work from personal. Often the two will try to merge. And so as a supervisor, what we have to do is be able to help others to be able to recognize that their own mental health is important in every aspect of their lives. And sometimes we often will see changes that come up. That's key. And so what we have to do is be able to be an ally and walk with them as they are maybe employees. Like I said, they may be supervisees that we're working with. If we notice changes, what should become a thing for them is to say, hey, this person actually cares enough to check in with me. They're also invested in my ability to be a good licensed therapist in the future, or counselor in the future, to be a good staff and so forth, eventually to be a potential leader. So there's some key things that we have to watch out for. Again, one of the biggest ones that often grabs individuals, and I'm actually using myself as an example over my 20 years of experience of doing this, time management often becomes key. A key thing that we have to really look at. And time management, from that, it kind of snowballs and it kind of rolls down the hill, affecting everything else. When we don't have the ability to manage our time, then we get ourselves in trouble. Because not only are we trying to manage time and get goals and things taken care of, whether it's, like I said, private practice, whether it's at our jobs and so forth, but then it begins to work itself into our personal. And so as a balance, we have to be able to set balance between the two. When your body says it's time to get rest, it will do it one of two ways. You do it and you get your rest, and or your body says, all right, shutting down, and we don't want the second one. We have to be able to help our supervisees to look at different ways to manage their time and so forth. The next thing that we've got to look at is, do you notice any changes as far as eating habits? Like if a person at one point was coming in with healthy foods, then the next thing you know, you see them, they're eating a lot of junk food, they're drinking a loads of coffee. It's okay to come and say, is everything okay? Because often what happens, because we're trying to not only manage time, but we're also trying to, get food in our bodies and stuff, we start making some choices that sometimes will have some major effects on us later on. I can tell you there was a time where I was eating fast food left and right, and I noticed the changes within a matter of days and realized that, hey, there's got to be some things we've got to do. You also got to check in sometimes when people come into this field. They come in with the best way to describe it is, hey, we got to save the world. I don't want anybody else to go through what I went through. And even though those are some great notions, but what happens often is that those things become buffers to what we really should be doing. I've had people where we've interviewed in the past, and what you have to be careful of, because of law, you can't discriminate based on if there's an illness, or even if there is mental health illnesses that they disclose to you. They don't necessarily have to, but if they do disclose to you, you got to be careful of discrimination. However, at the same time too, you also have to be very wise as they're working with clients. Is this going to affect the client's ability to get well? Not only is that, is this job going to become a deterrent for them to also get their own mental health up to a place where it needs to be? So often you have to tell individuals, and I actually was reading some posts the other day where people were concerned that paraprofessionals and therapists had their own therapists, and I said that's a great thing. In fact, when I was attending Mercer University, I remember Dr. Williamson and others there that said that it's very good to have someone to check in with. As a pastoral counselor, it is imperative that you're able to step, and talk with your own pastor if you feel comfortable with that. One of the things that we offer here at as you can see, I work with EYPC, but also with Well Living Counseling and Consulting, is that we do have an unbiased, closed form of therapy that we help pastors, youth leaders, and others to be able to talk about those things that may be difficult for them. Trust me, being a pastor is very difficult. Being a youth leader is very difficult. Being anyone that's working in a church is difficult, let alone if you're working in the mental health field. So even as I talk to those who are providing clinical supervision, it is very important that we also continue to look at how we're able to help our supervisees to recognize some things. And so whether you're working with a supervisee and you provide an assessment to get them to look at their personalities, but also there may be some aspects that they didn't even realize that were there. This is often done also with a lot of companies, especially in mental health, behavioral health agencies, that are now providing evaluations to see if their personalities fit, as well as if they maybe some things that the person may want to look at. And they may be higher, but they also want to provide other resources for them to get better. So what I am saying this morning is the following. And yes, I'm telling myself this because most of you can see that, the bags under the eyes there. Time management is very important. Being able to look at things and prioritize and say, hey, these are things that we can take care of. Sometimes you may have to do if you watched Dave Ramsey before, you may have to do a little snowballing. And basically you start with those small projects. And this is the thing that I've learned, again, in my experience, that sometimes the things that we think are huge projects, we find out are small projects. Because, again, we've got to get back to managing time, managing resources. So you find out about those things and set things priority and go from there. You also got to find time to rest. Find time to do things that you like to do. For me, I like paintballing. Haven't gone in a while. I also need to get back into shape. If you notice a drastic change in your weight, if you notice a drastic change in your sleeping patterns, you want to check into those things. Trust me, those things will have effect on you later. And so what we want to do is be able to empower our clinical supervisees, empower our staff to be able to check into their mental health, their behavior, and just look at things. Have things changed, and how does it affect not only how you work, your ability to do things like if you got to take that test to be able to get your licensure. How do you deal with your relationships with not only your clients but also with your fellow staff, or those if you're in a group private practice? How do you work with your colleagues and so forth? So we want to be able to be a supporter of that. So I use the discrimination model for clinical supervisees, and it often talks about consultation as well as counseling instead of being a therapist. Often we have people that come in to be a therapist. That may not be such a good idea often, because what you'll find out is that you'll end up doing more work with the staff and the supervisees as compared to preparing them to help others. And so what we're going to do is, again, set a balance with that. Check your meals out. I have decided, let's kill the fast food for a while. We got to detox this body here. Working out, looking at things like Planet Fitness, doing some things where you may be able to, in between, do some workouts. Find out what your favorite things are. So being able to also have someone that will be they may not be an advisor, but maybe there'll be someone that can do peer-to-peer with you and just check in with each other from time to time. So I'm saying this because we've got a lot of work to do. We've seen a lot of things that have happened in the last couple of weeks, in the last couple of days, actually. And I can only imagine how many of my colleagues out there that are in the mental health, behavioral health field, those that are dealing with pastoral counseling or youth leadership, what they're dealing with. And people are asking questions. And so prepare yourself not only spiritually, mentally, physically, be able to be the best you can be. That's the ultimate goal of this video. So doing that for encouragement, for us that are in leadership positions, that are supervising and so forth, be able to learn different ways to support people and how to support them as far as their mental health and their behavior and their own behavioral health. Because sometimes, behaviors change with mental health issues. So got any feedback or any ways to support people, any resources, please list it here on the comments below. We'll check in with you later. I'm Doc. I'm out.